York. Ebro in the morning on Hot 97.
Mayor de Blasio's on the line. Give it up. Talking about money.
Mayor de
Talking about money.
Blas.
De Blas, what's going on?
Is this? Do I get the free money? I'm ready. I'm ready.
Only if you're going to use it to fix the MTA or fix NYCHA. Which one?
I would donate it immediately. Immediately.
Good to know. We got a lot of ground to cover with you today. Thank you for taking the time out for Hot 97, our listeners today. Mayor de Blasio, big announcement the other day with regard to health care. Can you explain to us exactly how this is going to work?
Yep, it's called NYCHA, and it's a really simple idea. Anybody in New York City who needs health care will now have it guaranteed.
What does that mean? I just walk into a place and I have it? What do I have to do?
Now, here's how it goes. 600,000 people right now in this city have no health insurance. 600,000, which is like the size of the city of Baltimore. That's how many people in this town can't get health care when they need it. What we're saying is very clear. You will get a health care card through NYCHA. You'll get a primary doctor. You'll get specialists for the things you need. If you need pediatrics, maternity care, mental health care, whatever it is, you'll get a specialist who can provide that care to you. It's sliding scale. People will pay what they can pay. And this is true for folks who happen to be citizens but are not signed up for health insurance, but it's also true for folks who happen to be undocumented. We're going to get them care as well because we can't have New Yorkers walking around sick and not knowing where to turn or not feeling that they can get help unless they go to the emergency room. And, Ebro, this is the reality in the city, all over the country. The only place a lot of people feel they can turn is the emergency room. That should be the last resort, not the only place. That should be the last resort. This plan says, let's get people care when they need it. If people get care when they need it, they will be healthy. They won't end up in the emergency room.
Absolutely.
Do it proactively, not reactively.
Correct.
Now, Mayor de Blasio, when does this take full effect?
So, Laura, it's starting in waves. Some of it's immediate, and some of it's going to play out over the next 2 years. But some of the things that we're doing, people can start to access right away. We want everyone who can sign up for health insurance, meaning if you're a citizen and you haven't found what you want on the insurance exchange, we have a public option. It's called Metro Plus. It is affordable. It means that people
we know about Metro Plus. We've been working with Metro Plus up here for a while.
And we're going to make Metro Plus a lot more user-friendly. It's a good program, but what it has lacked is the ability to get the care when you need it in the way you want it. So we're going to have customer service. We're going to have a very streamlined system. Anyone's going to be able to call 24/7, talk about what they need, get connected to the right doctor in real time. So Metro Plus, people can start signing up for that right away if they are eligible. In terms of the bigger NYC care concept, including helping undocumented folks, that's going to be rolling out month by month in different parts of the city. But right now, everyone knows they could go to one of our public emergency rooms. This approach, again, is going to get people to actual doctors. You're going to have a doctor with a name and an address that becomes your regular primary care doctor that you can afford. That's how this vision will work. So some of it starts now, Laura. Some of it's going to play out over the next year or two. But by the time we get to the end of 2020, beginning of 2021, it will be in every corner of the city.
So for right now, I'm sorry, bro. Where can people find all the information they need to see if they qualify or if it's available in their area?
311 is the easiest way, or to go on the city website, and they can get connected to sign up for Metro Plus. And for folks, again, who are not qualified, we can at least make sure they know where they can go to a city clinic in the meantime. But this bigger kind of service is going to make it a lot more effective and help people get that primary doctor. That'll play out over time. But right now, anyone who wants more information can call 311.
Now, Mayor, why is this happening now and it didn't happen before? Where's the money coming from? Let's have real talk. You know, I want to know about the money. Who's paying for this?
I thought the free money you were talking about was going to cover this. Yeah, wait a minute.
Free Money Friday.
Free Money Fridays is paying for this.
There has been a misunderstanding. That's why I'm calling.
Yes.
Look, we said that this is going to, when it's fully built out, it's going to take at least $100 million a year. We will find that in the city budget. We believe healthcare is a priority. I believe healthcare is a right. So we're going to make it a budget priority. But the fact is, what's going to allow us to do is hire more doctors, hire more healthcare professionals, and also create a customer service plan that actually works for people. You know, most things in life are very difficult to navigate. That's what people find. Everyone's too busy. Everyone's working too long. They try and take care of themselves, take care of their family. It's tough to make sense of. We want to create something that's very easy to access. So it will take money, and we're going to make it a budget priority.
But what's not getting paid for? How does $100 million just fall out the sky? I mean, in some regard.
It's a priority. When any other priority, you say, we're going to make this something we do, even if there's some other things we can't do. Now, hopefully, the number one way we pay for this, and I believe this is true, is by continuing to save money, because people won't go to the emergency room and people won't end up hospitalized if their care is provided early when they need it.
Okay.
Now, emergency room is the single most expensive way to provide care, and hospitalization is a very costly thing, and no one wants to go through it. Those things happen when people don't get primary care. Those things happen when people don't take care of themselves on a regular basis. We believe that we flip the script and say, you now know how to get to a primary care doctor. It's easy. You need a specialist. You have a problem. It's diabetes, whatever it is. Here's how you can get help. That's going to keep people out of the hospital, out of the emergency room. That will save a lot of money.
Now, because I just find it hard to believe that that's going to be the only solution. Is the new money coming from the Amazon build, where we're getting $14 billion in tax, whatever we're getting from the Amazon thing? Is new money coming from recreational marijuana to help pay for this? Like, where, is it coming from that? Is it coming from the NYCHA 2.0 plan that I heard you rolled out that I want to get to next? Because there'll be some new city funds coming from private funds for that. Where's this money coming from?
So you're hitting the nail on the head. One of the reasons that I believed that the Amazon plan was so important for New York City is because it's going to bring in a vast amount of revenue. That's going to allow us to do things like this. I want a city that is fair for everyone, and that means creating, for example, the right to health care in real life. It's not just an idea, but it actually happens for people. I want to see public housing improve, more affordable housing. All these things cost money, and that's why when we can get a major company come in with 25,000 jobs, but also a ton of tax revenue, it helps us pay for a much more muscular approach to these issues where we can serve more and more people. So that's exactly part of it. So I think it's one part we're going to save a lot of money with fewer emergency room visits, fewer hospitalizations. Another part we're going to make it a budget priority. But another part, we're bringing in new revenue when we do something like the Amazon deal that's going to help us have a much stronger economy going forward. And one other thing I want to say to Laura's question, anyone who right now says, hey, wait a minute, I need health insurance, I went on the exchange, I couldn't find something I liked, I need health insurance, they can go online, metroplus.org. They can sign up right away. And again, we have a lot of different approaches that are affordable and can work for people.
NYCHA 2.0. I was reading on this. There's been problems in upgrading our buildings. There's been your controversies and things that you've been through, and your staff and hiring this person and et cetera, lead paint, blah, blah, blah. We've done it. We've seen all that. What exactly is NYCHA 2.0 and how does it work?
So the big picture, and a simple answer is right now the city of New York has committed to spend $5 billion so that the 400,000 people who live in public housing can live a better life. And that is real money. And the 2.0 plan says this: we're going to bring in a lot of city dollars, federal dollars, and private dollars to fix up apartments, to fix up buildings. We got 62,000 apartments that under this vision we're going to do a total rehab, totally redo the entire apartment, the entire building. If you go out to the Rockaways, you can see this plan has already been put into action at the Ocean Bay development. It's beautiful. It was a traditional NYCHA development. It was not in good shape. Went through this vision. It's been totally redone. Compost in the Lower East Side, same thing. We're going to be rolling this out all over the city. We're going to go right at those problems, the health and safety problems like lead, for example. It's a very, very aggressive plan. And I believe it's going to transform life in public housing because for the first time there is the will. So I'm 100% committed to fixing the problems at NYCHA. I don't think previous mayors tried to focus on NYCHA that much. To me, it's a high priority. We're putting our money where our mouth is. We're pushing the federal government and the state government to do their share. We want to see more from them. We're going to keep pushing.
Who was that, Ben? When Ben Carson came by, you guys had a convo, and he said he was going to step his HUD game up. Is that what happened?
Look, I think he's been very responsive. Now that we're working on an agreement that hopefully will nail down a common vision of the future, and I'd love to see some federal support in that plan. We're not all the way there yet, but I will say I want to give him credit. And I never knew the guy, and I didn't know what to make of him going in, but he's been very responsive. He wants to find a way to work this out together. And I think he, is flexible about the way we get there and trying to figure out a plan that will work. So I'm talking to him again today to keep moving this forward.
Are you saying, Mayor de Blasio, that Donald Trump, the current president, made a good hire in Ben Carson at HUD?
I am saying what I am experiencing.
Got it.
Wow.
I am saying that I did not know what to make of it. I never knew the guy. Obviously, we all said, is this someone who fits at an agency that, it's not his subject matter? But he has been responsive. He's made himself available. He's been open to figuring out a common solution. The Trump administration is an entirely different matter. I could talk all day about my critique and my disagreement.
Of course, we all can.
But in this instance, I have to say, I think he's treating New York City fairly. Now, we're not all there yet. So stay tuned. Let's see. We have a deadline at the end of this month. Let's see how we do that.
Now, my concern here, when you say private dollars and NYCHA, money coming in, are we watching right now a fundamental change in public housing where private dollars will have say-so in the cost of living, how people get treated, et cetera, et cetera? Like, what does that checks and balances look like? Because I think, not intentionally, but I don't see private money wanting to come in and help public housing unless there's some incentive or control or something for them.
There's incentive, but there's not control. So this is maintaining full public control. It is not privatization. I oppose privatization.
Okay.
The way this plan is structured, it's actually a plan that was developed by the Obama administration, and it specifically allows private and nonprofit management to come in and run these buildings. And it's a combination of some federal support that's brought in through the Section 8 program and the ability of the private and nonprofit entities to do some financing off these buildings. So I'm not an expert in how you do these financial deals, but it allows them to put together money and then rehab the buildings and manage the buildings. And they get paid to manage the buildings. But again, go out to this development in the Rockaways, and you'll see a lot of very satisfied residents. And here's another thing that's crucial, Ebro. Same residents who are in the buildings remain in the buildings. In the past, there was this horrible three-car Monte kind of thing where the governments would say, oh, we're going to fix up your housing. You just move out for a little while. We're going to fix it up. And then it was never fixed. It was torn down. People never got to come back.
Wow.
And this is the rehab of the building happens while people stay in the building. They move around within their own building as apartments are fixed, things like that. They get the same apartment back. They get the same rent level. Their rent levels are guaranteed. It's 30% of whatever your income is. That is guaranteed. Your succession rights are guaranteed. You have all the same things you had. We, the city, and NYCHA continue to own the land and to have veto power on all of the decisions. But what it's allowed us to do is to bring in some outside management that's been able to really improve the quality of life for people. And we're going to go big with this all over the city. I think it's going to be a game changer for people who live in NYCHA.
Is this also recognizing that the city's ability to manage things like this because of the controversies, acknowledging that's been problematic and bringing in some help from the outside?
I'd say it's a little different. I'd say you're talking about decades, basically since Ronald Reagan, 30, 40 years of disinvestment in public housing. If you had a house, Ebro, and you didn't take care of it for 30 or 40 years, and then, someone came along and said, well, your house really sucks, what are you going to do about it? You would have to start at that point trying to make things right. We're trying to do that now for literally enough housing for 400,000 people. This is a way to get some of these buildings fixed very intensely, get them done quick, get some relief in the situation. Other buildings, we're going to solve their problems in different ways. I think it's fair to say that, the housing authority was put through hell and the people who lived in it were put through hell by decades of disinvestment. We're trying to very quickly turn that around.
Now, can I make a suggestion?
Yeah, please.
Because I'm glad you pointed out the things that people who live in NYCHA and people who have experienced over generations and what they've gone through. There's a lack of trust there. There's no way that this aggressive plan goes off without a hitch. So as the hitches may or may not be coming, I think the ability for you and your administration to communicate with us is going to be key, because there's always going to be something. There's never, even like you brought up my own crib, if I have a contractor come, he tells me it's going to be done in 30 days, I automatically assume it's 90 or 120.
Yeah, look, you're right about the communication, and I would say historically, no one wanted to take responsibility for the housing authority. Federal government started walking away, as I said, back in 1980. State government has walked away since the 1990s. Mayors tried to, in too many ways, I think my predecessors looked away from NYCHA, did not claim responsibility. We're trying to reverse that. Change begins with accountability. So I have taken a lot of responsibility for the things the city has to do to support NYCHA. And we're going to show people real changes. I mean, you're seeing it right now. We still have, for example, heat problems. There's no question we have heat problems, but there's a big difference between last year and this year. Mm-hmm. Last year, the typical heating outage in NYCHA was over 2 days. This year, I think we've been running an average of about 11 hours, and we've had a lot fewer outages because we've got a lot more mechanics and experts in. We got a lot more mobile boilers. We did all sorts of things to improve service to people. So, if your heat's out for 11 hours versus 2 days or more, that's a difference in your life.
Oh,
now, we want to get the day when the heat doesn't go out at all.
It's just that there's a lack. I'm just saying there's been a lack of trust, and acknowledging that helps us all come to a better feeling of like, yo, this has been screwed up from generations, right? Mayor de Blasio says he's trying to do something, and as hitches come, people are going to go, oh, here we go again. He told us it was going to be all good, and it's not. So I just want to prepare us all for that.
That's fair. I accept your challenge, and I look forward to communicating by coming on this show and giving people updates.
Well, we appreciate you very much. Now, with all of these changes you're making right now, does it sound like he's trying to, run for president? You guys are, set a tone, health care and public housing? And
that wasn't what I received. Is that what you're throwing down?
I'm saying there's a lot of presidential runs being announced.
Mayor, is that what you're trying to throw down right here? Big announcement, 9:43 a.m. on this Friday?
I could think of no better place, but no, that's not what I'm here to announce. I'm here to tell you.
I resent the sarcasm.
I'm here to tell you, we are guaranteeing health care for all New Yorkers. We are guaranteeing that people are going to have 2 weeks of paid time off every year, because they deserve that. It's another big announcement we made yesterday. 2 weeks will be a law in this city. We're going to pass it with the city council. 2 weeks guaranteed time off every year. This is the kind of thing that people need to be able to live a decent life, because people are working longer and longer hours. They're getting less and less back for it. They're more and more stressed. We got to make healthcare easier. We got to make time off more available. These are the things we got to do to change this city. So I'm focused on the city. I've also said, Rosenberg, I'm going to spread this message around the country, because I want to see leaders all over the country take up these kind of ideas. I want to see our federal government take up these kind of ideas. This is a moment of real potential change. Don't get smoke screened by Donald Trump. He got 3 million votes less than his competitor, Hillary Clinton. I think there's a whole series of changes happening on the ground in this country that if we keep pushing them, they'll become the American reality. So that's what I'm here to do. Show we can do it in the biggest city country, preach the gospel wherever I can, that people can do this where they are too, and this is how we get on a path to change.
And then run for president in 2024.
I just want to be Ebro's running mate.
Yeah, we don't want that.
That's going to go down in flames. Now,
that's an unbeatable ticket right there.
Okay, more importantly, do you think that your beloved New England Patriots have it in them for another run on Sunday, or is this the end of the line?
I think the Chargers are a really impressive team, and I started out with the Patriots as a kid when they were a horrible team, expansion team. They had nothing going on, so I went through the lean years. This is going to be a tough game. So I'm not planning any parade.
I'll be honest, de Blasio, I forget that you're a Patriots fan. I don't like to be reminded.
It hurts you.
I had a great time hearing you talk about your big plans, and now it made me believe that some of these plans may not happen because you're a Patriots fan. I don't know if I can trust.
Laura, do you hear what's happening here?
I don't know if I can't trust it.
That's media bias right there.
I can't trust it. That's the definition of it. Y'all, give it up.
Thanks, Mayor de Blasio.
Mayor.
Mayor, we're going to have to, I'm going to need you to come back and hit me to how Cuomo all of a sudden thinks he can fix the MTA by himself and doesn't need any help. I need some insight on that. Why all of a sudden now? Why now you want control? Why now all of these things?
I'm going to tell you one thing that's the most important thing on the MTA. April 1st is D-Day. April 1st is the moment of decision. That is the day the state budget gets passed. If we're going to fix the MTA once and for all, it has to be decided by April 1st, and all of your listeners should be putting pressure on their state representatives, or their assembly members, their senators, to fix the MTA, to agree to a funding plan. I believe in a millionaire's tax. I think the best way to fix the MTA is to ask millionaires and billionaires to
I agree.
give a little more.
I agree.
But whatever plan, it has to be decided by April 1st. If we don't do it then, we're going to miss our best chance.
These politicians do not have the balls to ask rich people for more money. They don't. They're afraid. I'm telling you. They're afraid. They ain't got it.
You know what, Ebro? If the people demand it, this is why all of you have a very powerful platform here. You should help. I think you do it all the time, but in this case in particular, you should help people understand that they need to make their voices heard, that the subways must be fixed. April 1st is when it must be decided. Albany must take responsibility. I think the millionaire's tax is the best way, but whatever plan, whatever combination of pieces will get us to better subways, they got to get it done. But they need to feel pressure from the grassroots if that's going to happen.
There it is. Mayor de Blasio, one time, ladies and gentlemen. Give it up. We'll take caller number 9 next.